Welcome back to the Bolder Healthier Champions webinar series. I'm Dr. James Barnes, a GP trainee currently working in public health in Birmingham. This month we'll be looking at diabetes and its impact on the Birmingham population. The slides in this webinar will broadly outline what diabetes is, how big the problem is, and where public health and the Bolder Healthier Champions can input to make things better. Before looking at what we can do to help, it's worth having a bit of a look at the background of diabetes, what causes it, what symptoms we might see, and some of the treatments that might be available. To start with, let's take a look at what diabetes is. Diabetes is a lifelong condition of the metabolism, which leads to uncontrolled high blood sugar, and can broadly be defined into the two main types, type 1 and type 2, which we'll look at in more detail in a second. In the early stages, it may be that diabetes is treatable with lifestyle changes alone, but often many people will end up needing to take medication such as tablets, and some may end up having to have insulin injections for the rest of their life. Untreated, it can be very serious, causing problems with kidneys and eyesight, and can even lead to limb loss, heart attacks, and stroke. This damage often builds up over a number of years, so getting diagnosed and treated early can make all the difference. To explain a bit further about the different types of diabetes, there are many different types. This includes gestational diabetes, diabetes which is found only in pregnancy, and this can put you at greater risk of developing diabetes later on in life. But for the purpose of this webinar, we're going to focus mainly on the two main types of diabetes, shown here as type 1 and type 2. Type 1 diabetes normally starts at a younger age, but can actually be seen at any point. It happens when the body attacks the pancreas gland, which stops the production of a hormone called insulin. Insulin acts as a key, allowing sugar to move from the bloodstream into the cells of the body and helps fuel the body's processes. Whilst there's ongoing research into the disease, it's not currently considered preventable, and people with type 1 diabetes will need lifelong insulin injections to replace that not provided by the pancreas. Bolder Healthier Champions can help here by making sure that people with type 1 diabetes are supported at work with all their health needs. Type 2 diabetes is more related to insulin resistance, where the supply of insulin can't keep up with the needs of the body, and the insulin doesn't work as well as it could do. It is linked with obesity and can be prevented with lifestyle changes. We'll look later at pre-diabetes and the role in screening. Bolder Healthier Champions can help here by having more of a role in terms of promoting healthier lifestyles and raising awareness, and most of the rest of this talk will focus on this. So what kind of symptoms do we see in people with diabetes? Well, in someone living with diabetes, the uncontrolled high levels of sugar in their blood can lead to increased thirst, which in turn can cause someone with diabetes to need to go to the toilet more, often having to get up multiple times throughout the night to visit the bathroom. Because the lack of insulin stops sugar getting into the cells where it's needed, people may also experience low energy, being slow to heal cuts and bruises, or may lose weight unexpectedly. However, it should be noted that everyone is different, and some people might have very few symptoms despite being quite unwell. In some cases, people may only find out they have diabetes when they're in hospital for something else, which is why it's really important that people at risk get checked regularly. So what is the scale of the problem in our communities? The infographic you see on screen by the former Public Health England gives a little bit more detail, and I'll give you a few moments to read through it. At the current trend, 1 in 3 people in England will be obese by 2034, and 1 in 10 will be suffering with diabetes. The financial cost of this is huge. Currently, £8.8 billion a year, around 9% of the annual health budget is spent on diabetes, and this will only rise over time. This is especially a particular problem in Birmingham, where rates are around 50% higher than the national average. So what problems do we see in people living with diabetes? On screen, you can see just a few of the health problems that we commonly see in people suffering with diabetes. Often these are seen more often in those with higher sugars. Patients who adopt lifestyle changes, are aware of their diabetes and control their sugars well, will often get less of these complications, which is why it's so important that we get tested early and get treatment underway. Before we move on to what we can do to help, it's worth exploring the things that would increase an individual's risk of type 2 diabetes. The most important risk factor of all is obesity. Those individuals with a BMI, body mass index, of 25 or more and a waist circumference of more than 31.5 inches in women and 37 inches in men are at a 7-fold increased risk compared to those of a more healthy weight. Family history and age also play a part, with older people and people with many family members who also have diabetes being at higher risk. Deprivation is also a significant factor, with the prevalence of type 2 diabetes 60% higher in those in the most deprived quintile compared to those in the least deprived quintile in England. We also know that certain groups, particularly in a diverse community such as Birmingham, are at least 3 times more likely to develop type 2 diabetes than the white population. There's a bit of information on the screen here, which I'll give you a few moments to read. As you can see, a number of these are what we call modifiable risk factors, and the hope is that by targeting these through a number of interventions at both the individual and community levels, we might help build a bolder, healthier Birmingham. Now that we've looked at a bit of the background about diabetes and the things that cause it, let's move on to look at some of the things that we can do, both to prevent people from getting diabetes in the first place and to help those individuals who are already living with diabetes in the community. Let's start by looking at prevention. Broadly speaking, the 3 main NHS goals for preventing diabetes are very similar to those that you may have seen across other campaigns. And by helping with these, we can also reduce the risk of other diseases such as cardiovascular disease and stroke. Helping people to achieve a healthy weight, support healthy food choices, and achieving a good amount of physical activity all contribute towards reducing the number of people with poorly controlled diabetes. These can also be separated out into things that would help for those who already have diabetes, but also community-wide interventions to prevent people from getting diabetes in the first place. Some of the ideas of schemes and interventions that are already in place are displayed on the screen now, and it might be worth just taking a few minutes to read through these and think about which of these you may have seen yourself, or which of these could potentially be implemented into your area of working. One thing that wasn't mentioned in the previous slide, and one thing that is really important, is working out who may be at risk of developing diabetes or already has diabetes before they become more significantly unwell. Now, this is where a really important concept known as pre-diabetes comes in. Pre-diabetes is where an individual's blood sugar levels are higher than normal and their pancreas is struggling to keep up, but their blood sugar isn't high enough to be classed as full diabetes. They won't have any symptoms, but can be seen as being at a tipping point where early intervention can potentially prevent them from later developing full diabetes. So how would you know if you're in this at-risk category? Well, ultimately, the only way of knowing that you are pre-diabetic would be through having a blood test at your GP to see what your blood sugars are. But we wouldn't do this on absolutely everyone. Instead, we'd use a risk tool such as the Know Your Risk calculator used by type 2 diabetes in order to be able to stratify whether you're at a high or a lower risk group. For this, you'll need an accurate measurement of your height, weight, and waist circumference, and the website will also ask you some bits about your ethnic background and your any other illnesses you may have. Putting all of these together, it will give you a much better idea about yours or someone else's risk of developing diabetes in the future, and may give you recommendations as to whether you need to see your GP. One really important programme that is worth being aware of is the NHS Diabetes Prevention Programme. This service is accessed via the GPs as well as other healthcare professionals and consists of a number of group-based sessions delivered in person across a period of at least 9 months. There are at least 13 sessions lasting between 1 and 2 hours, and at least 16 hours of total contact time. These target the 3 areas of healthy living that we talked about before, with an aim to reduce progression of type 2 diabetes in the diabetic population and to reduce the progression of disease in the rest. Now that we've looked at the overall strategy, you might be wondering, where can I help and how can I contribute as a Bolder Healthier champion? That's what this part of the presentation will look at. Ways in which you as Bolder Healthier champions can work to help with many of the issues discussed today. We'd start by helping to make a diabetic friendly and healthy living workplace using the 3 points you see on screen here, the promotion, informing and helping model. To start with, by using diabetes as yet another reason to promote healthy living in your respective spheres of influence, we can make a real difference. Focusing on the goals of healthy eating and healthy activity, schemes such as Cycle to Work and access to healthier choices in staff canteens will undoubtedly help. In some settings, more novel ideas such as calorie information on food, using stand-up meetings and team away days with a health focus will help to reduce risk of diabetes, but also a number of other health issues. We also know that for some, a new diagnosis of diabetes can have a significant impact on their lives and can cause problems with mental health. Being aware of this and looking after staff, including signposting them to places that might offer support, is really important. As mentioned earlier, people living with diabetes often have extra needs and may benefit with extra support. Where appropriate, being open to having some of those difficult conversations with staff about their individual health needs can be really productive. In terms of specific ways in which you might be able to support those living with diabetes in the workplace, the charity Diabetes UK has a fantastic resource collection on its website, which can give advice on ways in which you may be able to help diabetic employees. Some ways in which you may support employees who have diabetes are by offering appropriate places where they might be able to check their blood sugars or to inject. For some, this can be quite difficult as they may not want to do it out in public and often end up having to, for example, hide in bathrooms just to check their blood sugar levels. Also, by offering a wider variety of different food options in staff canteens or vending machines, we can broadly promote healthy eating, which will help particularly patients with type 2 diabetes. For most people who are diabetic, they'll not have many issues on a day-to-day basis. But for those that have been newly diagnosed, it's a time of change in their life where a bit of extra support can be needed. It may be useful for new diabetics to be able to attend a diabetes course, particularly in those early days, and they may need extra time to be able to get to and from hospital appointments. In general, a just ask approach can be really useful, whereby asking employees what sort of support they need with their diabetes can be a really productive discussion. In particular, we know that people living with diabetes may need more mental health support, and knowing the signs of when someone is having difficulty can be really important. Having discussions about health or healthcare can be difficult, especially when it's not part of your day-to-day job. Even myself as a trainee doctor regularly find that there are some discussions that I'm just not expecting that can take me a little while to think about the right way of getting across my point of view. To help with this, I've just put on screen here a model that might be useful when talking to colleagues and employees about their health. To start with, I'd always recommend starting with an open question, one that doesn't have a yes or no answer, and gives someone the opportunity to say, actually, today I don't really want to talk about this. It might be best picking an appropriate time and place to have this discussion, as often people don't want to talk about intimate health problems in a broader setting where plenty of people are around. The assessing part of the model comes down to having an open-minded discussion with someone as to what might help. Try to ask them to come up with ideas at this stage rather than just jumping in to give them solutions. When we do this, we're more likely to get buy-in from the person involved, and the chances that they will then take up what you've suggested are more likely. Finally, the acting part comes down to finding useful solutions that fit the person's needs and will help to make their working day easier. For a bit of context, I've provided a few sample questions that I've put on the screen there. It might be worth having a quick look at those. So to summarise, diabetes is a significant problem with a number of knock-on complications for the residents of Birmingham. And at current trends, this is likely to only increase over the next decade. By making every contact count, we can aim to turn the tide on new diabetes diagnosis and also to help improve the lives of people currently living with diabetes across all of our workplaces. There's a whole host of information out there on the internet about diabetes, but it's really important that we use sources that we can trust. Diabetes UK, as mentioned before, is a charity that has a fantastic wealth of information online. And the NHS website also gives information not just on diabetes, but on a number of different health problems. For those people who are currently suffering with diabetes, their consultants and specialist nurses can offer advice and often give out contact details at the first appointment. For people that are worried about their blood sugar levels or want to get checked for diabetes, seeing a GP or other healthcare professional in your GP setting is always a good start. As also mentioned, a number of people living with diabetes are at higher risk of mental health problems. Because of this, I've put the website Mind on the screen, which is a good resource for anyone that has any forms of difficulties with their mental health. I'd like to finish by thanking you for taking the time to listen to this webinar.